Hi guys, my name is Nora Waters and this is my presentation on population health and philosophy. My objectives are going to be discussing systems thinking and synthesized scientific data, population and public health, our course learnings, big ideas and understandings that I've learned throughout the course, personal and educational philosophies. Systems thinking. What is systems thinking? Well, Barry Richmond coined this term in 1987 and defines it as the art and science of making reliable inferences about behavior by developing an increasingly deep understanding of underlying structures. Arnold and Wade, 2015, define it as a synergistic analytical skills that are used to improve the capability of identifying and understanding systems, predicting their behaviors, and devising modifications into them in order to produce desired effects. It's pretty much a way to approach complex and persistent problems effectively. Why is it so important? Well, it's a powerful approach to understand the nature of why situations are the way they are and then how to go about improving them. It tends to shift the way we think, communicate, and act, which allow us to recognize and problem solve to improve the quality of our decisions and performance, which will then in turn improve the quality of patient care. Think about every time we discuss a population and anything going on with them, such as obesity or an epidemic. We're looking how things are fitting together and how we can make them better. Vulnerable populations include women and children, elderly, and the socioeconomic disadvantaged or underinsured. These are vulnerable populations, and an understanding of what causes the health effects allows us to be a patient advocate and raise awareness, provide education, and define goals in their medical care. Big ideas. This course helped me to really discover what the true social determinants of health are, the need for an algorithm for suicidality in veterans, and what it is to have interprofessional collaboration. Social determinants of health are conditions for which people are born, grow, live, work, age, and they are shaped by the distribution of money, power, and resources at the global, national, and local levels. As you can see on this lovely graph graph that I show regarding the social determinants of health for population health, you can see that there are many different factors. Physical environment plays a part. Socioeconomic factors are a lot of things that can't be controlled, such as income. That accounts for most of it. Health behaviors, their personal diet, safe sex practices, that kind of stuff. And then access to healthcare also plays a part in this. According to Stanhope and Lancaster, nurses can recognize that these community health issues and social determinants of health and are able to focus on the community as a client. Suicidality of veterans. Our group project developed a proposal to identify and screen all veterans through the implementation of an interprofessional team approach. The objective of this proposal was to develop an algorithm, which you can see here, which screens veterans at the primary care level. And if that screen is positive, the nurse will then alert the interprofessional mental health team for secondary screening and treatment. This is highly important as the suicide rate between 2006 and 2016 has increased by 25.9%, and that only 24% total of veterans have ever been screened. Interprofessional collaboration. These are the three main things that I have noticed with interprofessional collaboration. It involves different interdisciplinary practices, teamwork, and an open communication. Interprofessional education is a collaborative approach to develop healthcare students as future interprofessional team members, and typically involves students from two or more different professions that are engaged in learning with, from, and about each other. Interprofessional collaboration is when a group of individuals, usually more than one, at least from more than one professional background or discipline, tend to work together with patients, families, caregivers, and communities to achieve a common goal of the highest quality of care. Damore, Ferrada Videla, Rodriguez, and Balut 2005 state that collaboration needs to be understood not only as a professional endeavor, but also as a human process. PG 2010 discusses that teamwork should be a positive experience with clear roles and communication, and that if there is conflict, it should be resolved effectively if the team member supports each other. Interprofessional core competencies are as followed. Values and ethics, which are when individuals work together to maintain a climate of mutual respect and shared values. Roles and responsibilities, which use the knowledge of one's own role and those of other professions, communities, to appropriately assess and address the healthcare needs of patients and to promote and advance the health of populations. Interprofessional collaboration is where you communicate with patients, families, communities, and other professionals in health and other fields in a responsive and responsible manner that supports a team approach to the promotion and maintenance of health and the prevention and treatment of disease. Teams and teamwork. This is applying a relationship building values and principles of team dynamics to perform effectively in different team roles to plan, deliver, and evaluate patient or population-centered care and population health and policies that are safe, timely, efficient, effective, and equitable. This is aimed to prepare healthcare professionals for advanced care and improve healthcare outcomes through collaborative teamwork. Philosophy of practice. My philosophy of practice focuses on compassion, empathy, morality, knowledge, and the skills that I've learned through evidence-based practices and interventions. My philosophy is continually evolving as I learn and grow throughout my personal life, education, and my nursing career in serving the poor population. My goals are to continue expanding and increasing my knowledge and effects of the health of these vulnerable populations. Thank you so much for listening to my presentation.